name is Margaret Caruso-Dorr. I will be performing a head-to-toe assessment on my patient. My husband David has agreed to do the assessment with me. Before David came into the room, he got into some comfortable clothing that we could do his assessment with. He emptied his bladder. I did a full set of vital signs on him. I did a height and weight, and I tested his distant vision with using the Snellen chart. Okay. So the first thing I'm going to do is I'm going to look at his general appearance and just overall appearance, and I did inspect his gait as he walked in the room, and his gait was even and fluid. The first thing I'm going to do is I'm going to look at his scalp and his hair. I'm going to look at his face. I'm going to note his skin. I'm going to look for symmetry of his ears, eyes, nose, and his facial structures. I'm going to ask him to perform a couple of tests for me. David, can you clench your teeth? Good. Can you close your eyes tightly? Good. Can you wrinkle your forehead? Good. Can you smile? Good. Stick out your tongue? Very good. And puff out your cheeks. Good. Okay. The next thing I'm going to do is I'm going to feel his scalp, noting any bumps, any masses. I know he does have a mole here on his right hairline. His hair, it's very thick, but it's smooth in texture. Okay. I'm going to palpate his facial bones. Okay. Make sure that they're symmetric. I'm going to palpate his temporomandibular joint. David, can you open and close your mouth? Good. Okay. And then I'm going to palpate his sinuses. Okay. Any pain? Okay, good. The next thing I'm going to do is I'm going to test light sensation. I'm going to take it. David, close your eyes for me. Tell me if you can feel this. Where is it?
Forehead. Cheek. Chin.
Good. Okay. The next thing I want to do is I want to palpate his nose, his pre-auricle, post-auricle, occipital, tonsillar, submental, submandibular, or mandibular, excuse me, his supraclavicular, superficial, cervical, posterior cervical, deep cervical, and his supraclavicular. Okay, that's good. Any pain with any of that? And I did not feel anything when I did that. Okay, good. The next thing I want to do is I'm going to test his strength in his head. Can you push your head against my hand? Turn your head and push it. And turn this way and push it. Good. And pull up with your shoulders. Very good. Okay. The next thing I want to do is I want to look at his eyes. I'm looking at his eyelashes. I'm looking at his eyelids. I don't see any abnormalities. His eyes are symmetrical. I'm going to palpate his lacrimal apparatus, which seems to be fine. Any pain or anything like that? Good. Okay. The next thing I'm going to do is I'm going to have him read something from about 14 inches away, and when I'm doing this, I am testing his near vision. So David, can you read what that says? Right here.
Reorder. Advent Gods.
Okay, good. Okay. The next thing I want to do is I want to check his pupillary response, and I'm going to check the regular pupillary response, and then I'm going to check his other pupil. So direct and consensual. Okay. If you just look straight ahead for me. Okay. So direct, and then looking at his other pupil, consensual. Okay. And direct and consensual. Okay, good. The next thing I want to do is I want to have David do a cover-uncover test, and I'm also looking for any stigmas or any pupillary response. So David, if you would just look at that wall, fixate on an object, cover your right eye with your right hand, okay, and uncover, and your left eye with your left hand, and uncover. Good. And I don't see any movement or anything of that nature. The next thing I would like to do is I'm going to test his extraocular movement. Can you look at this pen for me? Good. And I just want you to follow the pen with your eyes. Good. Very good. Okay. Checking his oculomotor. The next thing I would like to do is I'm going to come around back, David, and I want you to cover your right eye with your right hand. Okay? And I'm going to check your peripheral vision, okay? So you tell me when you can see my fingers. Ready?
No.
Okay?
No.
Good.
No.
Okay, good. And then your other eye, cover your other eye, and we'll do it again.
No.
Okay?
No. No.
Good. Okay. The next thing I want to do is look at David's ears. I want to look at his auricles. I want to make sure that his ears are in alignment. I want to note any, he does work out in the sun, so I want to really check his ears for any sunspots or any deformities. And I don't feel anything on his ears. Okay. So the next thing I would like to do is I'm going to do a rub test. And basically, I want you to tell me if you could hear my fingers rubbing.
Yes.
Okay, good. The next thing I would do is I would test him, David, using a tuning fork, doing the Weber's test. I don't have a tuning fork at this time, but I will use a prop. So I would bang the tuning fork on my hand and put it on his head. And then I would ask him if he could hear it equally in both sides. Okay, and that would be the Weber's test. The other test is the Ryan's test, in which case I would test air to bone conduction. I would take the tuning fork and I would put it behind his ear, and I would tell him to ask me when it stopped. And then once it stopped, I would put it about an inch in front of his ear and tell me when that would stop. That test between bone conduction and air conduction, air should be twice that of bone. Okay. The next thing I would like to do is look in David's ears. And I'm going to look at his tympanic membrane. Sure, you got that way a little bit good. And I don't see any redness or anything, and it looks nice and gray, which it's supposed to look. Silvery color. And turn your head a little bit for me. And same on this side. I don't see any redness. He does have a little bit of wax buildup in that ear. Okay. So the next thing I want to do is I'm going to look at his neck. I'm going to note any jugular vein pulsation, of which I don't see any of that. We did do the strength test already. I tested his head and I tested his shoulders. I'm going to palpate for a carotid pulse on both sides. But David, can you look up a little bit, thanks. And then I'm going to look at his trachea, make sure it's midline, and check his thyroid. Can you swallow for me? And swallow again. Good, okay. The next thing I want to do is I want to do we do the light sensation on your face? The cheeks and,
No.
okay. We'll test the light sensation on this face being that we skipped that part and I just remembered it. So close your eyes for me. Where is that?
Forehead. Cheek. Chin.
Good. So we're at the neck now, and I've palpated his carotids and looked for any jugular distension. I've looked at his thyroid and his trachea, made sure that it was midline, and now I'm going to palpate his carotids. Look up just a little for me. And I'm listening for bruise. I don't hear anything. Yeah. Good. And thyroid. Good. Okay. Next thing I want to do is I'm going to look at his upper extremities. I'm going to look at his hands, his arms, look at his muscle distribution. I'm feeling for temperature, any edema in his arms or anything. I'm going to look at his hands, okay, his fingers, and I'm going to check his capillary refill. Okay, David, flare your fingers out for me. Good. Make a fist. Great. Can you squeeze? Good. Push my hands. Good. Pull back. Great. Okay. I'm going to check his pulses. Radial and brachial. That looks good. So we're going to look at your shoulders now, and we're going to look at your range of motion. So can you lift your hands, your arms straight up for me? Good. And out to the sides. Good. And to your back. Great. And to your front. Good. Okay. So he's got pretty good range of motion in his shoulders, and that tested all well. So his upper extremities and everything tested very well. The next thing I'm going to do is I am going to go to David's back. And I am going to look at his thoracic region, okay? And that looks good. And David, I want you to turn around for me because I have to have you facing this way when I do your back. So if you could swing your legs this way. Good. Okay. So I'm just noting his thoracic region. Okay. And I'm going to note the costovertebral angles. Now, David, you're going to feel my hand, and I'm going to thump my hand with my fist, okay? It shouldn't hurt you at all, but tell me if you have any pain. And I'm going down to about the 10th rib when I do this. Any pain?
No.
Any pain?
No.
Okay, good. Now I'm just noting his cervical spine and his thoracic region, and everything seems to look good. I'm going to palpate now. Okay. And David, when I do this, can you say 99?
99, 99, 99, 99, 99.
Good, I'm checking for tactile firmness when I do that. And the next thing I want to do is, I've already palpated everything and I've checked for tactile firmness. I'm going to percuss, and I'm going to, should be bronchovesicular sounds. And when you percuss, you should do it in between the vertebral spaces. And then we'll percuss from side to side, noting the sounds on each side as we go along. did not hear anything that would make me think of consolidation or any fluid. So what I would like to do now is I'm going to check his lung expansion. And when I do this, I'm flaring out my hands, I'm putting my thumbs together, and David, I want you to take a nice big breath. And you see the thumbs move apart as the lung expands one more time. And good. Okay. The next thing I want to do is I want to look at his lung. I'm going to note his lung region again, and I am going to percuss his lung region. And can you hold on for 1 second? Sorry.